Hello, my name is Mohammed Hagamed, and I would like to spend the next few minutes to discuss an important aspect of cardiac arrest care that I think is very crucial for you to know and kind of hopefully discuss later. So we all like to know about the latest sexy and cool interventions in cardiac arrest care. However, we know what works best. So bystander CPR and timely defibrillation improve out-of-hospital cardiac arrest. Yet less than 50% of our patients receive these life-saving interventions. So this paper from the New England Journal of Medicine looked at the racial and ethnic differences in bystander CPR for witness cardiac arrest. They included more than 110,000 patients from a large registry data and mainly tried to find the incidence or the difference in incidence of cardiac arrest and bystander CPR in Black and Hispanic patients versus white patients. And they looked at the setting at home as well as in public settings such as airports and, gyms and recreation areas. So what did they find? So Black and Hispanic patients, their incidence of having bystander CPR, receiving bystander CPR was only 38% versus 47% for white individuals. And that number was 45% versus 60% in public locations. So where do we go from here? How can we ensure equitable access to bystander CPR? Well, I mean, you can give me a long time about this, but we have to start somewhere. First, we have to engage our community leaders. We have to make sure that we can provide free or low cost CPR trainings to our members of the community. And also we have to address the structural racism that exists in the current 911 system, such as funding for dispatcher-assisted CPR provided in language of the community. And last but not least, we have to acknowledge and also address implicit and explicit biases in bystander CPR. And with that, I look forward to your questions and discussions.